call it a dream, call it a plan. Dr. Vidhyadharan's passion in head and neck oncology, treating swallowing and snoring problems in patients, led him to dream, and his dreams were the blueprint and plan for the Head and Neck Center. I request Dr. Vidhyadharan to take us through his dreams and plans for THANC Hospital.
Welcome everyone. I would like to thank you all for coming on this very special day for me and my family. We are much obliged that you have taken the time to spend with us this Sunday morning with us. And it's a dream of every doctor to provide the best care possible for the patients. And it's even better if it involves following his or her own passion. That's the thing. So my passion lies in finding solutions to problems that I saw during my training and as a surgeon in the specialty, and also during working as a consultant in the same specialty. So I will just be putting on my PowerPoint if it's coming on screen. Okay, so welcome again. So the problem is that there are multiple problems I saw. I wanted to find the solution for that. See, in one of the examples is there's a huge disease burden in head and neck cancer, but there's a lack of awareness among our patients and sometimes of our care providers for evidence-based medicine. So that is something I wanted to address too. And some patients with neurologic illnesses and congenital syndromes, or some after head and neck cancer treatment, they don't have any proper understanding of voice rehabilitation. And this is something I wanted to create awareness and help these people on that point. And with regard to problems such as complex airway problems in terms of breathing, there were lack of many state-of-art centers dedicated to a comprehensive management of these problems. So these are the problems I encountered during the training, during working, and I wanted to address on these things. So what is the thing with every patient? I felt that there should be a way to do better, do something, but do better and address these things. So my passion was to set up a comprehensive head and neck center, not only to treat head and neck diseases, but also to restore function. So this is one quote we can, which kind of was personal to me: find your passion and you will find a niche. So that's one thing, and we will focus on quality of life of our patients. Now, to do this, searching for passion, trying to find these solutions, just a master's degree is not enough. I resonated with this quote too. And how to do that? I needed mentors, and mentors who will help me understand and groom me to what situation I am now. A truly great mentor is hard to find, difficult to part with, and impossible to forget. So with that thing, I had the opportunity of working under these excellent 4 mentors, and I was lucky to have these mentors whom I can never forget. And besides guiding me in the pursuit of my passion, they've taught me valuable life lessons, and working hard in a smart way and pioneering new technology is very common. It's a common trait for all these mentors. There's a great opportunity for me to emulate and highlight certain points which I've tried to imbibe and emulate from these mentors. So I will be, the next few slides, I will be telling that. I first started working as an ENT surgeon under Professor Mohan Kameshwaran after my training. He was my first mentor as an ENT surgeon, and in setting up and securing my fundamentals in understanding ENT as a specialty. The beautiful things I learned from watching Mohan Kameshwaran sir, working with him, was that he exudes compassion. When you see him with the patients, he is very warm, reassuring, comforting, and any patient in his OP is very busy from 5 to night 12 o'clock. He's in the same tempo, always, giving him that warm, reassuring feeling. That thing, which you could see, is a very big quality in a doctor and in a surgeon too, especially in a surgeon. He's always patient, and he's very well organized and articulate. You would see when he gives a talk. He's never unprepared. Any situation is always articulate, and he's always very keen on the well-being of his team and always ever caring. And I've seen him use the drill like as if he's a paintbrush, like a Michelangelo. He just glides, and the surgery finishes in 1 hour, and then the next surgery it goes on like that. And he's rewarded by many ENT surgeons for this skill. He's an example of creating his own legacy And his wife, Mrs. Inda Commission, is always a well-wisher in the hospital. And also the team at Murph is always being very supportive for me. And even after I passed out, they always welcome me. I come and meet them, and they're always very, very welcoming. And he is a pioneer of implantation otology in, I'd say, in India and at least Southeast Asia, I feel. The next person is Dr. Subramania Iyer. I was very grateful to him for accepting me as his fellow in 2012. When I just, after my first stint in Australia, I came back, and ever since it's been a journey of self-evolution for me. And I learned everything about head and neck oncology from him. If you see his photo, he's ever smiling. There's never a photo of him without a smile, and I'm sure he's smiling behind the mask also now, everything. And the beauty is that he's very creative, very innovative. Sometimes we don't know what he's thinking until the time he puts a knife on the patient, then everything just comes out like a masterpiece. And he also has a spiritual way of looking at things. And there's this side, as you spend longer time, you understand your bosses a bit more on the other emotional aspect, not just the professional side. He's always trying to find solutions to a problem, to dwell on it. So every staff in the hospital, in the department, they have about, I think, close to 130 staffs. I see the staff during Onam functions with all of them, and all of them revere him. And he's like one of those persons, he says, the show must go on, get anything done, don't sit on a problem, just get things done. And that was his go-to motto. And he's always open to new, an alternative way of doing things. And he identifies talent, that's a thing of a leader, and he ends up delegating responsibilities to that appropriate person. And that's how I ended up managing the Swallowing Disorder Center at Amrita for some period of time. I'm very grateful for that experience also. He pioneered hand transplant and the tracheal transplant in India. And these are the life lessons I learned from Sir. Next is Dr. Jaykumar Menon, sir. I had the opportunity of working with him side by side at Amrita Institute. I was very thankful that he trained me as he would train any of his fellows. Even though he had come as a visiting consultant, he always saw me as a student and kind of groomed me, and that was very nice. He's a very generous and honest soul, and more than that, he's a self-made individual in his own specialty. Not many people know this specialty about the voice box of the organ, and he, basically dedicated his life to that. And with all this, he still has a lot of humility. In fact, even today I was saying, sir, do you need a coat, a blazer or something? No, I'm okay, I'm fine. I was like, okay, sir. This is also the Amrita way of being very simple. Oh, sorry. I think can you put, thank you. So he's an encyclopedia of knowledge on voice problems and swallowing problems. Anytime we ask a question, he has an answer, or he says, let's look it up. And that's the thing about a big professor. And he's keen on trying out new things, but always with the focus of safety. And that's very good for our patients also. He has exemplary diagnostic skills. He can see that's why I wanted him to open up our swallowing endoscopic suite, so that, I remember every time I see a voice box or throat, I remember him, because every point he'll just point out, this is the problem, this is the problem. So exemplary diagnostic skills, and a very good singer. And he mixes his hobby with his work. So he's actually a singer he's actually a doctor for many voice professionals, singing professionals. And he's also revered by many voice specialists in the country, and he's a pioneer in the field of laryngology. So thank you, sir. And the last but not the least is Mr. Suren Krishnan. He is based in Australia. Unfortunately, because of COVID, he will not be able to come, but I do have a video to the end of the talk, so I would play his video. He inspired me to take up head and neck surgery. I had the pleasure of getting trained in robotic surgery for about 2 years at different time periods under him. And more than a mentor, he is always like a father in a home away from home. So he was like a father to me and my wife when we were there, and his wife would also take care of us, call us home for dinner and looked after us. We had like a little India in his house in Australia. And Mr. Krishnan, when he walks into the hospital, he exudes confidence. Even the white surgeons, all the other surgeons would, that they give him the respect. And he's a second generation Australian there. He's very kind and generous. He does a lot of charity work. He goes to Africa and operates for free. And he's empathetic. He's a good listener. That's why he's like a good father over there. I used to tell all my problems, and he would give me advice. He's very supportive and optimistic, always positive for the patients. enthusiastic and willing to share his professional skills. Not many lead mentors do that. They will tell their final point. They don't want you to make that mistake they made. They will, before you make the mistake, he will tell you, Vidya, and it's annoying, but I know you get it, you listen, you progress to the next stage. And he also told me the importance of family time. You work hard, but also spend time with your family needs to be, because, if they are happy at home, you are happy at work. That Tamila, that bharam is not there. At least you're relaxed and do good work here. He has a lot of integrity, high moral and ethical standards. He even stood for being a mayor in the city in Australia. And he's a surgeon, that's what I felt. And he pioneered robotic surgery in Australia. So with this, I'd actually go a little bit into the head and neck region. This slide highlights the functions of the structures within the head and neck, and all these functions are important for us to live a normal personal and social life. We take this for granted, and we realize its importance only when we lose it. And we knew it now during COVID. People are losing smell, losing taste, and you know how valuable it was. As ENT surgeons, it's a routine for us, but general public do not know how valuable these functions are. The ability to breathe, the ability to smell, to taste, to chew, to swallow safely, to voice or vocalize, to speak, to hear, and to smile. So these functions are the ones I felt that we need to pay more focus on and get these patients back to normal, whoever we treat them. So a gross functionally disabled patient actually disables the whole family which cares for him. If he cannot eat, he cannot talk, he cannot walk, the family which cares for him also feels that the strain and the pressure of that. So that's why I wanted to take this quality of life, this functional thing, as my mantra or the mission for this hospital, and that's why I've designed this hospital with the family for this particular purpose. THANC Hospital is a dedicated center for specialties treating diseases of the head and neck region. It provides a comprehensive and affordable service which will fulfill a hitherto unmet need within the society. And this is the problem I saw, and I was hoping to find solutions for that. I want to merge my expertise, the compassion, with the latest technology and provide the best possible care. Each patient, I feel, is unique, and that is the current scenario everywhere. Everybody wants to do individualized, personalized, patient-centered approach, and I hope to do that with the best practice-driven approach on focusing on preventing or re-establishing the lost functions of the patient in this area. You can see how passionate I am. I just knocked the mic. Sorry about that. Okay. So this hospital will focus on a wholesome patient-centered approach with these specialties as key specialties. We do have general ENT, general surgery, and general medicine, but the specialized specialties are there for you to see. These departments are there at present. So the aim is to keep doing better and keep at it, doing better. And this is very simple, but sometimes we do forget in the mundane routine. So do better and keep doing better at it. And the uniqueness to THANC, or the head and neck center, would be focusing on the quality of cure. And we always focus on the cure, forget the quality of cure, what treatment you're doing, whether it's actually helping the patient and the whole family, financially, medically, everywhere. So focus on the quality of cure. Future, I aim to do many things, establish center, but hopefully create a legacy like these two hospitals. And as per former President of India, Abdul Kalam says, dream is not which you see while sleeping, it is something that does not let you sleep. So I want to keep dreaming. That's why I kept the slide blank, but hopefully to follow the legacy of these two hospitals and the ethics. I thank my parents and my family, and that's my family. Of course, my little daughter, still haven't taken a family photo yet, so, and that's us taking a new step forward. Because it's not only professionally, whole family comes behind when you start a new project, and all the support I get. My wife has been with me all through these years, like all the big people here. I'm sure their wives have been very supportive, so I thank my wife and thank my parents for being supportive, and I thank my parents-in-laws who have been guiding pillars in every phase and giving me advice whenever possible. My grandparents-in-law, my Dr. Raj Sabhabati and Mrs. Raj Sabhabati, Dr. Raj Shekharan and Mrs. Raj Shekharan, my in-laws. And I also would like to thank Dr. Anant and Mrs. Gayatri for who have our relatives who have the Curie Hospital, and they've been very supportive in our initial starting phase, and my cousins and my brothers and my other colleagues. Thank you very much. I would also like to thank the THANC staff for helping out on this Sunday. Thank you. So go ahead. Thank you.
You playing the video? It is said that a teacher arrives when a student is ready, and hearing Dr. Vidhyadharan's passionate speech about his mentors and his journey to the inaugural of THANC Hospital today, I'm sure his mentors are proud of their student and wishing him and THANC Hospital the very best, and to keep continuing to better their best. Thank you, Dr. Vidhyadharan, and wish you all the very best.